Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Christine King. She's a nurse anesthetist. Today's Kevin MD article is The Heartbreaking Pandemic Story I Will Never Forget. Christine, welcome to the show.
Thank you. Thank you very much.
All right, so tell us a little about your story briefly, and then the article that you wrote on Kevin MD for those who didn't get a chance to read it.
Sure. So I am a nurse anesthetist. I'm based in Pittsburgh, Pennsylvania. I was a nurse in critical care for about 12 years when I went to anesthesia school. Personal goal to attain a master's degree. I wanted to work more autonomously. And yeah, I felt like it was the top of the nursing profession. So that's why I chose that path.
All right, and your article is about COVID-19. Tell us your story.
Yes. Well, it was, 5 years ago. So I was reflecting upon that. And I've seen a lot of articles lately about COVID-19 and that because we hit the 5 year mark.
Yeah.
And this story occurred after things had kind of settled down. The vaccine was available. This gentleman came in and he just told us the story that was just he was how lonely and isolated he was during the pandemic and how he really had decided that he was going to end his life. And the
Mhm.
only thing that kept him alive was the fact that he had cats to take care of at home. And that got him through. And it just really touched me because he was so vulnerable in that moment. And this was when people were just coming back to start routine testing again, because a lot of people avoided the hospital during the pandemic.
Mhm.
And it just made such an impression on me when he told me that story.
And what was the setting where he said this? Was he admitted to the hospital, and how did he tell you?
Oh, he was an outpatient for a colonoscopy, a GI procedure.
Sure.
So it was because during the pandemic, we only did really took care of inpatients in that department. We didn't really have outpatients. So
So,
it was scary times.
so as he was telling you the story about how this patient was thinking about taking his life, and the only thing preventing him from doing so were his cats. So, as he was relaying the story to you, what was going through your mind?
I felt so much compassion for him
Mhm.
because as difficult as things were during the pandemic for healthcare workers, we went into work every day. We weren't isolated. We had each other to rely on and to depend on. And there were so many people that didn't have that. I think the pandemic hit all of us in very different ways, but at least I had the support of my coworkers at that time.
So, you were a nurse anesthetist. I assume that you did a lot of inpatient procedures, surgeries, critical care things, certainly during the pandemic. What was it like for you during those dark times?
It was very difficult because before the vaccine was available, you just felt very exposed. There was one of our GI department usually did about 10 cases a day, 10 to 12 cases a day. And one of the doctors said, out of the 10 patients we're taking care of today, one of them will probably be COVID positive and not know it.
Mm.
We took a lot of precautions, but we were still, even though that is our job to take care of sick people, we were still exposed to something that really wasn't well known at all.
Yeah.
And we were coming home to our families and had to find a way to protect them as well, which made it difficult too.
And how did that whole experience living through COVID and all the uncertainty through COVID, how did that change you as a clinician?
I think changed me in a lot of ways. I was very surprised at how many of my coworkers and clinicians in general became very anti-mask and very anti-vaccine very, very quickly.
Yeah.
Because when the vaccine first came out, there was so much relief in the hospital. Just this, I remember people posting on social media about how relieved they were and about how happy they were to finally have this, because it was a long time between March and end of December, beginning of January when that was available, and how quickly that changed. And it just that surprised me a lot. I did not expect that.
And you could almost say that it's a reflection, of course, of our greater society, where right now there's just a lot of skepticism against the vaccines, a lot of skepticism towards masking, and in a way, there's a lot of trust in our public health institutions and our medical professional institutions. So now that you've had time to reflect, 5 years out from COVID, what are you seeing about the attitudes towards healthcare professionals, towards public health, and some of the lessons that the public seems to have learned or not about the whole pandemic experience?
Oh, I think that things are fairly bleak. I mean, the I listened to your podcast yesterday, and your guest mentioned violence against healthcare workers. I think that has gotten much worse, and I do think the pandemic is partially responsible because we went from healthcare heroes to villains so quickly. And I think people, it just measles coming back is very frightening to me. I have twin grandsons who have gotten all their vaccines, and I actually printed the CDC schedule of pediatric vaccines because
Hmm.
I wasn't sure, when everything changed 2 months ago, I wasn't sure if that information was going to be available, and I wanted to make sure that we had it. I think COVID vaccine skepticism has become mainstream. Even the Novavax vaccine, which is a different mechanism, that people are suspicious of that.
Hmm.
That's more of a traditional vaccine thing. People are very suspicious of it. COVID hasn't gone away. Measles is coming back. H1N1 is in the background. And I still think that the supply chain is not ready for another pandemic to come down the line. And I don't know, because everything's been cut, if people are even tracking that anymore. I
Hmm.
just, it's very difficult. Things are changing very fast, and it's very frightening to me.
So, are you personally witnessing some of that hostility and some of that anti-medicine sentiment during your normal day as a nurse anesthetist? Are you seeing that personally?
I think most of the patients that come into the hospital are very happy to have the care that they receive.
Okay.
I have pulled back a lot from friendships in the workplace because of that type of opinion. I am starting to call things out. Like, I was in a social situation where people started to not necessarily say anything about the vaccines, but they were talking about masks in general. And I work in an OR, we wear masks all the time.
Yeah.
So to hear someone say masks don't work, I am starting to speak out respectfully, but just, say to people, if you have surgery, I would wear a mask in the room for you to prevent infection. We've done that for 100 years, well before the pandemic, or
Hmm.
specifically the COVID pandemic. So, I am starting to respectfully call people out for their views.
And sometimes, as you said, it's costing you your personal relationships with some people.
Absolutely. I have family members that have really been yeah, really cut me out of their life, and friendships that really have just changed. They're not the same.
And it's purely because of differing stances when it comes to things like masking and vaccines.
Absolutely. Yes. So
What
I
are
have found, a group of people who are supportive of it, and it's just changed so much. I never expected the amount of change.
Do you see a path forward for those who have lost trust in medical professionals and lost trust in public health? Do you see a path forward to perhaps sway them back, like you said, for the next pandemic?
I think one thing is, the service you provide with your website and with this podcast, because I think journalists in general are communication majors, and they don't understand the medical system, and they don't understand how things work in healthcare. And to have experts that are able to kind of explain those concepts to the general public, instead of a journalist who's trying to figure out how that works and communicate it. I think that type of thing is going to. And I also, and it's unfortunate, but I think that as more people get sick and are affected by not having these vaccines, that it's going to change a lot of minds too. And that's unfortunate that it has to come to that.
I completely agree with you when you say that because when it's online and on social media, it's very easy to be polarized because everyone is in their own individual silos. But when it's face to face, like you said, you haven't witnessed a lot of personal animosity against you when you're face to face patients. For the most part, they're very appreciative of the care they receive. And that's my stance as well. Whenever I talk to patients, even if they don't agree with things like vaccines and masks, it's always a very civil discussion. And at least it gives me the opportunity to plant that seed in their mind that perhaps the next time this happens again, they may reconsider.
And I agree with that because again, with the mask conversation, when people are just thinking about masks in response to COVID, it's different. But when you say, oh, we wear them in the OR all the time and always have to protect you from infection, I think that does make an impact because it makes people think, okay, well, we're using this in a different circumstance
Mhm.
and they do work. So it just gives them a different perspective.
In your article, you wrote about the phrase, I'm glad that you're still here. And it hits different now, 5 years from the pandemic. So tell us more about that.
This gentleman was just so vulnerable. And I just felt that he really needed to hear that somebody, even a stranger, was happy that he was there and
Yeah.
he had somebody to talk to. Because I think really at the end of the day, all we have is being kind to each other. And that makes a huge, huge difference. So I think we have to have more of that in the future. No, we're not going to agree on everything, but we can be kind when we talk to each other about our differences.
And as healthcare professionals, we're in a unique position to do that because a lot of times in primary care, when they come see me for their appointment, it's really the social highlight of their day. Not to say that,
Yes.
no, not to say that anyone's social highlight, but a lot of times when I ask them what else do they have to do today, really coming in to see me to see the physician is all they're doing socially that day. So it does give us a unique opportunity.
Oh, absolutely. I think there's, even without the pandemic, I think people in general are really lonely. And I noticed that too. You can always tell an older person who hasn't had a person to talk to for a long time
Yeah.
because they really want to have a deep conversation with you.
Now, from a behavioral health standpoint, you mentioned all the emotional turmoil and stress that healthcare professionals had gone through during the pandemic. They were at first heroes, and now they're in some cases villains. How do you yourself manage that, and talk about some of the support that you have needed or gone through to help make it through the pandemic era from a behavioral health standpoint?
Well, I journaled a lot through the pandemic. In fact, in preparation for this today, I was leafing through it and just some of the things that happen. It's amazing how you forget, even in 5 years, how much you actually forget.
Yeah.
And I don't know, I therapy helped. So that's I'm a big believer in that.
We're talking to Christine King. She's a nurse anesthetist. Today's Kevin MD article is The Heartbreaking Pandemic Story I Will Never Forget. Christine, let's end with some take home messages that you want to leave with the Kevin MD audience.
I think that I'm going to go back to just be kind. And also, there is a public good that we have to be aware of. And yes, individualism is important, but we also have an obligation to look after each other.
Christine, thank you so much for sharing your story, perspective, and insight. And thanks again for coming on the show.
Thank you very much.